Hi, Mason Nation. It's time for our monthly podcast, and I am so happy to be your host today. My name is Mrs. Delzer, and aside from being the activities director, I'm also an English teacher and huge supporter of all things promoting positive mental health. Last year, you might remember we began March with something called Mesa's Mindful March. Unfortunately, it was cut short due to this thing called COVID-19 and a global pandemic. You may have heard of that. But we're back this March with more reasons, more ideas, and an even better opportunity to talk about the importance of mental health. Joining us today is NMUSD's mental health guru, Kristin Henry, and our very own Mr. Kaska, or Mrs. Kaska's husband and physician assistant for Share Yourselves, Ben Kaska. So thank you so much for joining us.
Thank you for having me.
We are very excited. So let's start with you, Mrs. Henry, and a couple of questions that we have for you kind of about mental health and about your position at the district. You are our mental health and outreach coordinator, which is awesome. And I have absolutely loved the email that you sent me about just getting to know you a little bit. So why don't you tell our listeners a little bit about you?
So I'm actually really new to my job. I just started my job in July. But before that, I was working still in Newport Mesa, but in the special education department. And I started as a school psychologist and then went back to school and got a postgraduate certificate in school neuropsychology. And then left my original job as a school psychologist to go to Santa Ana, where I was a mental health program specialist. And then I joined Newport Mesa just maybe 4 years ago as a special education coordinator. And when this position opened up, it was the outreach and mental health position. And through our conversations and after my getting hired, we were able to kind of shift things a little bit. Our district has been amazing at really supporting students who are in crisis and students with IEPs that have really profound needs. But something I've always been really passionate about, even when I was working in special education, was about kind of like flipping the mentality and stopping thinking about mental health as this situation that happens to a handful of people that we need to help, and thinking about how all of us are affected by it, how all of us have anxiety and depression, and how this is really just a human condition of suffering and struggle. And so the more we can talk about that, the more that people realize like, oh, wait, and I wish that someone had told me that when I was in high school, because I really struggled a lot with anxiety. And I shared with you, I've been diagnosed with ADHD. So I had my own struggles and really felt like I was just on an island. And I, through my own experiences and then through learning and then being a helper, I've realized like, it's not like, are you someone with a problem? It's like, what's your problem? What are you struggling with today? What is
totally.
that like?
And I think that's been so great. And I think Newport Mesa has done such an amazing job in this last year. I mean, even before this last year, of really getting resources into the hands of families and resources into the hands of students. And so I was in a meeting with you earlier this year with Dr. D'Agostino, and you were talking to our superintendent advisory committee members about kind of a new program, or at least it was a newer program for me, the CARE Solace program. And so that I'm just kind of seeing all over our website and the district website. Do you want to tell us a little bit about that program?
Yeah, that's awesome. So we just started that. It was actually the Friday before Christmas. We've been working on the contract and all the details and talk about like flipping the script and getting mental health supports in the hands of everyone. That was just thrilling when I got the email, like we're all good to go on the Friday before the winter break. And so I sent this mass email out with like, I had made like, put this on Twitter. We're loading this on the district website. Here's an email to send to your friends. This is because what it was it's a care concierge service. So it really does 3 different things. And the first one is that it's just a website that you can go to. Anybody who is a student at Newport Mesa, family member of Newport Mesa in our community, teachers, families, really anyone in our entire community. You can log on to this website, and it's our website. I wrote it down so that I would be able to say it. Where is it? It's caresolace.com. So care Solace, SOLACE.com, and then /NMUSD. So that's our website. You go onto the website and you can either do it totally anonymously, or you can even click, and it can be in any language. So talk about accessibility.
Absolutely.
Right then and there. It also can be completely anonymous, or if you want help, you can get help. And what it does, it asks 9 separate questions about whether you need either substance use, is it an issue of substance use, or it's an issue of mental health. You narrow it down to what specifically the need is, whether it's anxiety, depression, trauma, PTSD, even divorce, anything that, you narrow it down, and then they provide you with a list of available service providers that have been vetted. They are licensed and credentialed. They don't have any legal issues there. They've been working for at least 3 years. So the company links you to them. And that part of it, I love because when you are suffering, when you're in crisis,
right,
it's tough to ask for help.
Sure.
It's tough to know where to go to ask for help. So you have to be really at your bravest and best self to be like, hey, I'm over here. Can I get some help? And then you call and you get the wrong number, or they don't take your insurance, and so it's like hurdle after hurdle when you're in no condition to do any of it, let alone all of it, and then be super vulnerable and honest. So this you can do without help. You can do it with help. And then they will even help you make the appointment, and they'll match with your insurance. It's great. And certainly there will be issues with it. However, we've had hundreds of people use it since December, hundreds. And I mean, it might even be thousands by now and so you think that those are people who maybe wouldn't have asked for help otherwise.
Well, and the thing I love about it is kind of what you said about a one-stop shop kind of concierge service. And so if you're not familiar with the term concierge, that's what you do when you go on vacation. You call someone, you're like, I'd like to make a dinner reservation here. And the concierge says, great, I know exactly where to take you, or I know exactly where to call. And so it kind of takes the worry out of your hand because they're able to kind of walk you through the process. And so for our families and for our students, and that was great. I'm going to have you say that website one more time.
Yes. So it's Care Solace, CARE, and then Solace, SOLACE.com/NMUSD. You also can go to our website and find it. I'm sure on your school's website. I know that's linked on a lot of those pages. And then I've sent out a lot of infographics and those types of supports. The other thing it does is that if we have a staff member that's at school and they're working with either a family in crisis or a student in crisis, if they get the right consent from the family, they're able to work in unison. So our school psychologists, our social workers, our counselors are able to work with Care Solace to say, I have a family here. This is what they're going through. Could you help link them up to supports? And then Care Solace will do the logistical, getting the appointments, all that part of it. But then they keep us in contact. So we're able to see they're getting support. Oh, they were able to go last Tuesday, which is really important information for us when we're talking about students that we're trying to help and families that we're trying to help. And it just gives us one more way that we can be informed and connected with our students.
Yeah. And it sounds like, the communication sounds like it's really strong, which is great.
Yeah, and it has been. And of course, it's all done on this beautiful dashboard that looks like a lovely infographic, and the information is super accessible. And the third part that I really is so meaningful to me as a coordinator of mental health and wellness is that I have all of the data, not connected to any humans, but I know, again, how many people have used it, who's using it the most, what the age group is, what our teenagers are struggling with the most. So I know that right now our primary issue of the people that are using Care Solace is anxiety for females. And that's really important information to have, especially because you think about anxiety for females, and those aren't the people who are typically on our radar. Typically, the kids on our radar are the ones that are acting out, that are crying for help, but the other ones kind of slip through the cracks. With this information, I'm able to develop supports and systems and structures and go to the board and say, we're having, a lot of kids with anxiety that are female. We're just so much better informed in a way that's really helpful in planning and designing supports. So I think that's so great. And I don't know that
many of our listeners, I know that when you shared this information with us at the meeting, at the superintendent advisory committee meeting, I was like, oh, this is new information. I, even as an educator in the district, I wasn't aware. And so we felt like it was so important for you to be able to share that with our listeners. And then just to kind of wrap up your portion, Mrs. Henry, you said something else in the email that I'd sent to you, is kind of the getting to know you piece, and just kind of prepping you for what we were going to talk about today. And I asked you about kind of what was trending in the realm of mental health. And I loved what you answered, just kind of about the spirit and the honesty of the human condition. Do you want to tell our listeners kind of what you think, what your thoughts are about that?
Yeah. Well, when you asked me, I was thinking, and I'm excited to hear what Mr. Kaska has to say too about this.
Yeah.
But, there's so much talk, especially pre-pandemic and at the beginning of the pandemic, about like, I know I was even pushing it, like building our resilience and like, we've got this, and we're gonna, with gratitude practice, we can be better and stronger. And through the course of the past year, I think we've done all of that, where we're like gonna save the day and do all the work and be hard. And now it's come to a place where, we can't control all the different conditions to make things better. So what we've really had to come to terms with is that this is rough, and that even in tough times, like, we can be compassionate to ourselves and to one another and kind of muddle through it together. And there's been a real honesty about the struggles with mental health. It's like we kind of would dance around it before, but it's like up in our noses. There's no denying kind of what I was saying before, just the struggles of the human condition. And I love the brain science and how meditation and gratitude practice, like, it's amazing. But really right now, it's been such a silver lining of COVID that we've really reduced the stigma of depression and anxiety. And the community of people, and especially I think the younger generation,
people. Mm-hmm.
Yeah, like, there is such an honesty about, like, it's okay not to be okay.
Yeah. It's what's so crazy is I feel like we as a school community were really starting to move in that direction last year, kind of pre-COVID. Like, that whole idea of MESA's Mindful March was generated by the students in this class, generated by the ASB students, because they saw a need, talking to their peers or what their own struggles were, and then coming out with kind of this awareness of mental health. And then all of a sudden this happened, and it's like, not that was a great platform, but it's like they've really developed kind of what it is that they wanted even last year. And so I'm going to bring in Mr. Kaska here, as in Mrs. Kaska's husband, this is a shameless plug for your wife's program, but her Dancing with the Teachers this last week was fantastic. So if you haven't checked it out, check it out. Next time we're going to see you dancing in it, Ben.
Oh, I don't know.
So thanks for coming in and hanging out with us today. We appreciate you being here. Ben works for, I guess I could let you tell our listeners, for SOS, or Share Ourselves, a nonprofit here in Costa Mesa, who probably works with a lot of our families as a physician assistant. Do you want to just tell us a little bit about maybe how you got started, why you wanted to be a PA, and maybe a little bit about SOS would be great.
Sure. Yeah. Thank you so much for including me on this. I'm really excited. When I told Mrs. Kaska, Cynthia, that I was going to be doing this, she was tickled pink. So yeah. Thanks so much for bringing me on. So SOS, or Share Ourselves, we're a federally qualified healthcare center. We serve all of Orange County. We have 5 sites. Our flagship site is off Superior Avenue, kind of next to Hogue. And we're a full scope family practice medical clinic, meaning that we handle everything from prenatal care all the way through geriatric and end of life. And we have a pediatric center right next to the Hogue Hospital emergency room. And we have roughly between 18 to 22,000 patients. And that spans that entire age group. We also offer mental health services, very similar to what you were describing. We have psychiatrists and as well as psychologists and LCSW folks as well. So we specialize in serving the most at-risk patient population. So we serve a wide variety of patients, from the affluent all the way to very destitute. But we like to make sure that we do the best we possibly can in bolstering and supporting and keeping a safe boundary around those that are the most at risk. So think of homelessness, substance abuse, obviously mental health conditions fall into those categories. And we are a bilingual / trilingual facility. So I speak Spanish. And that was one of the reasons I wanted to start joining. That's one of the reasons I joined the SOS clinic, was that we have a very large population who are Spanish speaking only. And providing that kind of excellent medical care to that very specific patient population is something that's very important to me in supporting the community, especially the most vulnerable patients in our community. So why PA? Why I want to be a PA?
Yeah.
Well, I started wanting to be a PhD, a research scientist, and I got started and was working at the bench, and it was I got like the black lab benches, and I wasn't talking to anybody, and I wasn't interacting with anybody, and I was just doing little experiments, and I was miserable. It was terrible. Talk about a mental health disaster. It was killing my soul. So actually, Mrs. Kaska would come and visit me in the wee hours of the morning and in the evenings as I was doing these little experiments, and it just wasn't the life I wanted, and it was making me very sad. So I thought, I love science. I hate research, so I'll try clinical medicine. So I actually, the way it all worked out was I got an email from my academic advisor at UC Irvine, where Mrs. Kaska and I went to school, and it was like and they said there's this clinic that wants medical volunteers, where I missed the deadline in order to actually do the interview to be the medical volunteer. So I just decided, I'll show up and just kind of see if they'll take me. So I didn't have an interview, and I showed up and I'm like, hi, I'd like to participate. And they're like, are you on the list? And I'm like, I thought I was, kinda. I wasn't. And they just allowed me to have the interview, and I ended up getting accepted into this little medical volunteer program. And I was assigned to a PA who I thought was a doctor for the first 6 months I was working with him. I didn't know he was a PA, not a doctor. And I loved what he did. Everything he did was exactly what I wanted to do with my life. So about 6 months in, I realized he was a PA and not a doctor. And I'm like, what in the world's a PA? So he explained it to me, and I'm like, wait, so I only have to go to 2 or 3 years of postgraduate school. I don't have to do the MCAT. I don't have to go to med school and then residency and then a fellowship and then whatever else. He's like, yeah, no, in and out. And I'm like, well, that sounds pretty ideal, you know, and very much more financially digestible. So I became I went to USC for my PA program and joined SOS as my first job out of school. And 9 years later, I am still there as the clinical director. So yeah, I love it. It's really a wonderful place to work, and I really love my career, and I love what I'm doing. And
yeah, you can hear it. You can, both of you, you're so passionate about what you do. And I think that that's what's so helpful. So Ben, kind of what Kristin was talking about as far as, even the research that she was getting from on the Care Solace program, talking about mental health and anxiety and depression in young women, which was really interesting. Are you at SOS after this last year, are you seeing more patients? Are you seeing more kind of not an uprising in people who are coming forward with more depression, anxiety, and just kind of environmental based on where we have been this last year?
Tremendous, tremendous increase. And the thing that comes, I think, across the strongest is I have patients who have what's called general anxiety disorder, which means they're always anxious about everything, or people who have major depressive disorder, which means they're depressed all the time. And now we should probably mention here that if something terrible happens in your life, it's normal to feel depressed about that. It's normal to feel sad about that. That's totally normal. What we're talking about is folks who, no matter what happens, they are always anxious or they're always depressed. And it's debilitating. It makes it so they can't function well at a job. It makes it so they can't eat food, get enough nutrients, or get enough sleep, or do your normal activities of daily living, getting dressed, getting clean. So the thing that hit me the hardest with this is I had a patient who suffers from these conditions, these debilitating conditions where they're just always feeling horrible. And they said to me that during the pandemic, they finally feel like everyone else in the world understands them, because for the first time, everyone else is feeling really sad and feeling really anxious and feeling really worried. And to have this patient expressed to me that they're finally feeling like the world can see them for how they feel on a daily basis was a really eye-opening experience for me. And yes, I feel like across the board, everyone that I know and every patient that I've seen has suffered in some way, shape, or form, or in some capacity with the COVID-19. Whether it's they feel sad because their life has changed dramatically, or they feel anxious because they're worried that they're gonna go to Save On or 99-cent store and touch the keypad and then get the virus. So something that as innocuous as that, has affected the patients tremendously. And those that are already feeling at that level on a daily basis it has had a tremendously negative impact on them as well. We've seen an uptick, a big one. And
that's super interesting. Yeah. And I mean, interesting what you said about, for those people who are already experiencing that, to then have everybody else kind of be a part of their world, that's really interesting to me. As a physician, Ben, do you have any advice for our Mason Nation about staying mentally healthy? Like, what would you tell, some of your patients, just about kind of hopeful things to do, or meditation, or yoga, or healthy diet, just kind of staying mentally healthy? What are some things that you might suggest?
I think the first thing that we should make sure we state is we have to talk about it. If you're feeling anxious, if you're feeling sad, don't just sit with it. Don't let it brew. Don't let it fester. Don't let it get bad. If you're feeling sad, or if you're feeling anxious, or if you're feeling depressed, or whatever you want to call it, the blues, bummed out, that's my favorite term. If you just don't feel right, find someone to talk to. And as much as we might love our peer support group, as wonderful as they may be, they might not be giving always the best advice.
Sure.
So finding someone who's a professional to speak to, whether that's through the school, or whether that's through a medical provider, or whether that's through even these like tele apps, these apps where you can speak to someone, and removing the stigma. This idea that there's stigma related to this is so old and patriarchal, and not the type of medicine that we believe is effective or the right way we want to handle this. So removing those stigmas, removing those barriers, and just starting the conversation is really where we need to start. And then, of course, there's other things that I highly recommend, exercise being probably the number one thing to at least, I guess I'm speaking from my worldview, but exercise is tremendously important to me and has really gotten me through a good portion of this pandemic. And then beyond that, if someone is spiritual or religious, praying is a wonderful, like, meditative, mindful exercise for those who are non-denominational, just meditation in general, yoga, just something where you can take time for just yourself, focus on something other than your surroundings is typically very effective. And that can be like heavy weightlifting, that can be bicycling, swimming. I know those two things might not be always accessible, but just mindfulness and meditation can be wonderful.
That's great advice. Kristin, do you want to jump in with anything there? I know, do you have any kind of advice for our Mason Nation too? Ben, that's great advice. Thank you.
I have the answer.
Okay, good.
Tell me, I need to know.
I think you actually already said it. Which I think I totally agree with you that the first part is just being like a blabbermouth about it, just talking about it. And I touched on it before, but the awareness of your inner critic and of the inner negativity that kind of is hardwired in us to, from an evolutionary perspective, to kind of keep us safe and small. Like, we have these, like, don't do that, that's no good, you're not very good at that, to like keep us from making big bad decisions or like getting eaten by lions and tigers. But so just I think having an awareness that that's part of the human condition, is that negative voice that's inside of us. So once you're aware of it, and then like kind of almost turning the volume up on it to like get to know it, like what is it saying over and over again, and then having compassion for ourselves, the same that we would for a friend, because I think that we are so hard on ourselves. And I just, yesterday a friend called me and was like, oh, I can't believe I did this and this and this. And I said to her, hold on, what would you say if I did those things? And she said, well, I would tell you it's fine, nobody cares, it's fine. And I was like, no, it's okay, say that stuff to yourself. And I think that really is foreign to us. So it's something that I'm personally working on, and I think there's a lot of great science on it. And in addition to the physical exercise, the novelty, being able to do things. I mean, our brains in times of stress and anxiety, the greatest things for a healthy brain are, novelty, physical exercise, interconnectedness, like all of the things that we've really had to back burner. So as things are opening up, like finding those times to do those activities. And one other thing that that Ben said that made me think about the anxiety and coming back to school too. Social anxieties it's a real thing. It's a real thing. Personally, I see, and I was we had a panel of students that we met with and got some insight from, and they were all saying like, I don't know how to like be social anymore. And like I went and saw a friend for the first time in forever, and I was like, how do we even do this? And so I think that just having again some self-compassion and acceptance that we're going to kind of muddle through it. It's maybe going to be a little awkward to be social and like see a person's whole body when they're standing and talking to you versus just standing up. Like, oh, you're shorter than I thought you were, and like all of those little social, seeing the whole face, like what? So.
Mrs. Henry, I really liked what you said about being compassionate to ourselves and turning down the negative or critical self-talk that we have just like as a ruminating cycle in the brain. I was just talking to Mrs. Kaska today because today is our son's first birthday. Owen turned 1.
Happy birthday, Owen.
Yeah. So some of you might know, I think, Mrs. Delzer, I think you were actually at Zoe's first birthday, and it was like a 65-person blowout bash with like a taco truck, and it was an event. And that was obviously in like 2019. And for Owen, for our son, because we're in the midst of a pandemic and we are rule followers and respect public health, we have done nothing for our son. And I was feeling a little like, am I a good parent? Like I didn't do anything. Like I didn't have a party. And then it's like, well, you're not supposed to, babe. Like if you're having a party, you're doing it wrong. So we made him a little a paper crown, and we stuck it on the top of his head with some tape, and like that. And you know what? That's what it's going to have to be this time. And I'm right there with you of this like critical self-talk of like, man, you're missing your son's first birthday. Like,
right.
You're not doing enough, man. You got to do more. Cause like, look what you did for your daughter. And it's like, no, you cannot compare any other year you've ever had to this year. So if you're not hitting your goals,
be great. It'll go down in history as probably one of the best birthdays ever, and you'll remember who did that paper crown. It'll be so dear to you.
It was a pretty good paper crown, I will say.
I got a picture. I got a picture, and my lips are sealed. You'll never have to know about Zoe's party. I'll take it to my grave. I'll take it to my grave.
Good, thank you.
That's a great kind of like lighter note to segue into our like last segment, which is the fun segment. This is a big topic, and I'm so grateful to both of you for coming on today, and I'm so happy we're able to get this information out to our community to continue the conversation. And I think that that's the important part, is just continuing the conversation, finding someone to talk to, not being afraid to talk about it, and all of those things. So I appreciate that. So this section is called the MANIAC segment, and it's like a this or that. And so I'm going to ask you, two questions. I'm going to say 2 words basically, and you tell me which one you would pick. So for example, we'll go beach or mountains, and then Kristin can go first, and then Ben, you could jump in. So beach or mountains?
Mountains.
Beach.
Ben. Okay. Netflix or Hulu?
Hulu. I know, it's hard.
Netflix.
Okay. Baking or cooking?
Cooking.
Okay. Takeout or home cooked meals?
Home cooked meals.
Home cooked.
Coffee or tea?
Tea.
Ooh, can I say iced coffee? Can I
Yeah.
Be sassy? Okay.
Yeah. You can, Cloth masks or medical masks?
Cloth.
Can I be sassy again?
Sure.
Okay. Surgical underneath, cloth over the top.
Okay, perfect, Ben. And then last question, The Mandalorian or WandaVision?
WandaVision.
These are hard.
I know, right?
Mandalorian, because Baby Yoda is the cutest thing in the entire world.
I know. I would have to agree. I know. They're hard questions. I know the kids came up with all of those. Well, thank you so much today for your time, for your expertise, for spending it's just some time talking about, something that's so important. I really appreciate it. And you'll be famous now. Ben, you missed my little speech with Kristin about how now you can put on your resume official podcaster.
Oh.
So yeah. So I'm a double threat this week, podcaster and YouTuber, since my Dancing with the Teachers host stint.
Whoa.
I'll sign an autograph for you.
Please. Thank you.
Well, thank you again for joining us, and Mesa Nation, to all of you listening. Thank you so much for listening, and stay tuned for our next podcast coming at you in April.